Good evening, everyone. A hearty welcome to all our participants. We'll be beginning the webinar for today. Phobase Care has taken a new initiative, Know Your Psychological Management with Cancer. This will be a meeting for patients undergoing cancer treatment and for their caregivers. Ms. Jaitri Mandal, a psycho-oncologist at Phobase Care, will be the speaker for today's event. And I, Ms. Maria, content writer for Phobase Care, will be moderating. Every month, we'll be coming here to virtually discuss the emotional concerns and management in cancer care and to clear all your doubts. Caregivers and cancer patients can openly discuss your emotional concerns here. Today will be our first meetup with you all, and we'll be discussing about the importance of psycho-oncology, the importance of having personalized counseling sessions for cancer patients. Today, Ms. Jaitri, our psycho-oncologist at Phobase Care, will help us understand more in detail about emotional needs and concerns among cancer patients. It's a pleasure for me today to introduce Ms. Jaitri. She has been associated with Phobase Care since February of 2022. She has completed her MPhil in Psycho-Oncology and MSc in Health Psychology and has provided around 500 psycho-oncological consultations for patients at Phobase Care till date. I'm now requesting Ms. Jaitri Mandal to take it over.
Thank you, Maria, for this amazing introduction. Good evening, everyone. My name is Jaitri Mandal. Currently, I'm associated with Phobase Care as a psycho-oncologist. And as a psycho-oncologist, I basically take care of the psychological, social, and behavioral aspects of cancer care for both cancer patients and caregivers to provide them a holistic quality of life. So today, before starting the event, let's present and discuss a very brief PowerPoint presentation to explain the need of psycho-oncology for the cancer community. Before starting the discussion, let's talk about a case. Imagine here patient X, who is a breast cancer warrior with locally advanced stage. Now, if we talk about the current concern of the patient, it will be majorly the anxiety, the distress related to various treatment-related concerns and probably the side effects as well. It can be body image issues, the fear of losing the own self or losing the control. On the contrary, if we talk about the spouse who is wife, who is probably the primary caregiver, for them, the primary concerns will be managing the entire treatment process, probably the appointment, scheduling one appointment with the doctors or taking the patient to the proper time to the doctors and then scheduling the follow-up sessions, on managing the occupation and also managing the other finance and household chores as well. So here, if you see on a very holistic way, not only the patients, but also the caregivers, their distress level during the entire cancer journey becomes very severe. So here comes the roles of psycho-oncology and again psycho-oncologist. So now if we try to define psycho-oncology, it will be, it's a very super specialty field of psychology. And as a psycho-oncologist, as I spoke earlier as well, so here we take care of basically the psychological, social, and behavioral aspects of the cancer care, again to provide a holistic quality of life. After that, we will move to the point that when and why you should consult a psycho-oncologist, or when there is a need that you feel now this is the time I need to go to a psycho-oncologist for my consultation. So during the entire cancer journey, majorly two types of issues that both the cancer patients and our caregivers they can experience. Number one will be the health-related apprehension and anxiety. And the another one is surely the adjustment issues during the entire travel journey. The first one and the most commonly experienced is fear of relapse for the patient. For example, if my cancer come back once again, what should I do? Or probably why me cognition? Why it has happened to me? Because throughout my life, I have lived a very healthy lifestyle. I have never done any sin. I have never hurt anyone. Then why with me? Negative automatic thoughts of cancer. For example, you are reading any book or you are cooking or you are teaching your kids. Then also you are constantly thinking about if my cancer comes back again, what will happen? I need to go for the follow-up probably on the next month. What will happen during my chemotherapy? What side effects I will experience if something bad happens with me? These are called the negative automatic thoughts of cancer. Sometimes, again, it's very difficult to accept the diagnosis and the prognosis itself. Sometimes all these factors can cause your severe anxiety, like the constant anxiety, your palpitation, sometimes breathlessness. You will not be able to focus on any work. You will start losing interest in any activity. You can also start getting certain anticipatory symptoms. For example, chemo-induced nausea and vomiting. The side effects after chemotherapy, that is basically not real, but you are anticipating because you have already got some previous experiences, all because of the anxiety. Sometimes severe anger issues and irritability. Because of the treatment protocol, we have seen people losing probably one body part, probably, for example, one hand, or probably the lower limb, sometimes breast. That also is going to give you a very severe body image issue. Sometimes you will not be able to adjust to the environment, or probably your functioning, your work functioning can also reduce as well. Reduce life roles and aspirations, and also uncertainty about the future and life expectancy, worried about the family members. All these things together can really cause severe anxiety and depression, and sometimes other factors as well, adjustment issues, adjustment disorders, various sleep problems. You will not be able to sleep properly at night, intermittent or disturbed sleep pattern. So during the entire journey, you need to consult to a psycho-oncologist or a therapist for a better solution. So now we'll be talking about, depending upon these problems that already I have mentioned, what sort of interventions you can get. The most important and most commonly used intervention that we use, like today, all the patients are here and they are definitely aware that what interventions I mainly use with them whenever I take any session. First and foremost will be the distress or the stress management. And that always comes with deep breathing exercise. Deep breathing exercise can be of various types. It can be mindfulness breathing, sometimes abdominal breathing, sometimes JPMR, which is basically progressive muscle relaxation strategy. Sometimes simple walking, probably thrice a day, 5 minutes in the morning, 5 in the afternoon, and 5 minutes in the evening or night. Sometimes here and now approach, in the sense not allowing me to think too much either about the past or about the future, rather than trying to be very much strict to think only about the current situation, my present. That is called here and now approach. Another thing is that cancer-related fatigue. We all know that cancer is not a very 1 or 2 day disease. It's a very long, prolonged period. So here the weakness or the fatigue will be not only physiological, but also psychological as well. So in this time, you should consult with your psychologist to get an overview or many strategies how you can make yourself more engaged. Because the more you will push yourself or motivate yourself to various activity or engaging activity or destructive activity, you will feel like you are gaining more strength than before. Sleep disturbance is very common. You may experience intermittent sleep pattern, onset of dreams, sometimes disturbed sleep pattern, or probably you will be waking up in between multiple times at night and it will be difficult for you to go back to sleep. In those times, multiple techniques, for example, sleep hygiene, sometimes stimulus control can be very much helpful for you to sleep better. Depression can come any point of time during this long journey. So here, cognitive behavioral therapy, consistent, supportive, and motivational counseling. For example, how you can motivate yourself and also how the caregivers can motivate you to run the entire show. These things can also be taught and trained by your psychologist. And again, as I spoke earlier, like because of the entire treatment, the side effects sometimes within a couple, many psychosexual concerns can arise.
One of our patient has asked one question. So the patient has asked in Bengali. So the question is, in case of sleeping disturbance, medicine can used. So since the patient is Bengali, if you are comfortable, you can answer this in Bengali as well.
Okay.
Or I can translate on behalf of you, whatever will be done.
So I'll be answering it in English, so that all our participants can get some idea about it, like how to manage the sleep issues. So Like, first of all, it's very important for us to understand, like, the moment you are not able to sleep, exactly what is the problem that you are facing. Either are you lying on bed and at night you are not able to sleep, that is called the late onset of sleep. Number two can be that probably you are waking up in between multiple times, around 3, in between, the way we have commonly seen in our clinical practice, somewhere in between 3 to 3:30 a.m. you are waking up multiple times and you are not able to sleep because probably you are going to washroom or probably you are coughing a lot. So all these issues you are experiencing. So here, the first thing will be, number one, always scheduling a proper time, which is called the sleep-wake cycle. So for example, if you want to go to sleep each and every day by 10 p.m., so make sure that you are going to bed by 10 p.m. only on a regular basis. Whenever you are sleeping, at least after your dinner, do not consume any sort of coffee or tea, or even do not engage yourself into very strenuous physical activity, rather than at least wait for half an hour. Before going for bed, please try to maintain certain sleep hygiene exercise. For example, whenever you are lying on bed, please close your eyes and tell yourself that my today was good and my tomorrow, it will surely be better, without any doubt. Close your eyes, lie down, practice simple deep breathing exercise, and then you can understand that you will fall asleep very easily. Number two, also in between, if you are waking up at around 3:30, and then it will be very difficult for you to go back to sleep once again. In that time, what you can do, simply go to washroom, wash your face. After that, do not try to lie down on the bed and close your eyes and try to sleep. Rather than that, try to walk around the room for some time. The moment you will feel that your body has become absolutely exhausted and probably now you do not have any energy, sit on the bed, listen some music, or probably just practice the deep breathing exercise once again while lying on bed. You will fall asleep easily. And Aditi, I will request you to translate the answer to the patient. I wish that this can be helpful for him.
Okay, I'll translate it personally.
Basically, the interventions that we use. So coming to the summarization, from the psycho-oncology perspective, the majorly commonly used interventions are the stress management, the cancer-related fatigue management, the sleep disturbance, depression, and handling multiple types of psychosexual concerns through majorly marital and couple counseling. But apart from that also, we provide other techniques, for example, need-based counseling, sometimes majorly involving the caregivers into the session so that they can also be a part of it, because caregivers burnout is a very important thing. And as a psycho-oncologist, we try to focus both on the patients and the caregivers on the same time. Now we'll be moving ahead with the question answer session.
Thank you, Ms. Jaitri, for the wonderful presentation. I'm sure your introduction on psycho-oncology is going to make them understand how important it is a part of cancer care. We'll be now moving to the discussion session about psycho-oncology, unlocking the impact of personalized counseling session for cancer patients during and after cancer treatment with our participants. I request all the participants to type in any questions and queries you have in the chat box in any language you find comfortable. Our other panelists, Mr. Kumar, will be taking questions from Facebook Live, and Mrs. Aditi will be translating the questions in regional languages. So please to provide any questions you have. We have received some questions. Ms. Jaitri, in case of lack of sleep, a patient wants to know that in case of lack of sleep, is taking medication advisable? Ms. Jaitri, what will be your take on that?
So first of all, my advice should be, if your doctor and your oncologist has advised you to take the medication for better sleep, without any hesitation, please go ahead with that. Whenever we take the counseling session, the major concern that comes up with sleep medication particularly, whether I will be addicted to it. But let me tell you that there are very clear difference between the use and abuse. the moment you are having any sleep disturbance, and to manage that, you should take the pain medication, you should take the sleep medication as per your doctor's recommendation. So please go ahead with that. You will not be getting addicted at all. Neither your major organs will be getting affected, sir. I guess that I'm clear with my answer.
Thank you, Ms. Jaitri, for that wonderful answer. I'm sure it's going to be very helpful to the patient. We are moving with the next question. A patient wants to know that they are forgetting that many concerned memories are there, and they are forgetting few memories, and they're concerned about it. They want to know if it can be fixed or what any remedies are there. So, Ms. Jaitri, what is your opinion on that?
So my answer for this question will be, first of all, it's very important for us to know why there is a forgetting or why there is a memory disturbance, or if the patient is talking while sleeping. These are the major symptoms. Now, it can happen for multiple reasons. There can be for chemobrain, which is basically a confusional state. It can be even because of disturbed sleep pattern completely when my patient is not able to sleep at night and rather than sleeping mostly during the daytime. And sometimes brain mets as well, in the sense when there is a metastatic in the brain part. So these are the major reasons. Depending upon the cause, the intervention will be different. But if I talk about the very commonly used strategies, those will be, first of all, whenever the patient is starting a day, make sure that he or she will be making one to-do list. For example, what work need to be done, and also writing it. Writing it's very important. Number 2 can be, try to have an open communication with your caregivers regarding a very important points. For example, what is your name? What is my name? What is my address? When is our birthdays or probably marriage anniversaries? Number 3 can be, please show some old photographs. Give it to the patient and ask them to explain it. For example, where is the place? Who all are there in the photos? Can you remember? Then again, always keeping one calendar and wall clock in front of them. And also always to ask them, can you please tell me what is the day today? What is the date today? What is the time today? What are you having now? When you had your lunch, what you had your lunch? These are the very small techniques that we can use.
Thank you, Ms. Jaitri, for answering the query. We are next moving to the next. Anger and irritability is a great part. So a patient wants to know that how to manage anger and irritability in cancer treatment, during cancer treatment. Ms. Jaitri, what will be your take on that?
Both anger and irritability during the cancer treatment can come at any point of time. So for that, again, it's very important to understand what is the reason for my anger or my irritability. It can be even during my side effects of treatment as well. It can be some sort of unfulfilled wishes that I planned for something, but now I'm not able to do because I have certain restrictions in terms of either physical or emotional or financial because of my disease factor mostly. So here, first of all, number 1 that I will recommend for my patients always, that try to have a very open communication with your family members. Like why you are feeling sad or why you are feeling irritable or why you are so much angry. Number 2, try to figuring out the triggering effects or the triggering factors that you know that fine, if I experience this or if you tell me this, then probably I will be angry. Very important is that the moment you are experiencing it or you are listening to it, you are feeling it, please try to avoid the situation and then engage yourself into something else. Probably you can just go for a small brisk walk. You can just go for, engaging you into something else. It can be listening music, watching a movie, or probably simply fast or deep breathing exercise. It means that I am changing my environment to cut that channel. And another thing is very important. We need to understand our emotions can be our either our friend or our enemy. So the moment I'm irritated or I'm angry, I can express something in certain way, or I can tell you something in certain way that I may feel guilty after some time as well. That's the reason it's very important that all the patients should understand, and it's for caregivers as well. If you are irritable or if you're angry, then and there, please do not try to express your emotions or justify some point, rather than when you and the another person both are in a very calm and polite stage, that time sit together and talk about it. Talk why you were angry that time. Talk what are the factors those are making you irritable. And the last but the most important point is that try to find out somewhere, like someone probably within your home or within your college or your employment place, your office, or your own psycho-oncologist or therapist who can really address your emotions, who can understand your emotions so well that they can give you a proper solution. They can help you to cope better. It means we are human beings. We have all the emotions, and all the emotions are very valid. But we need to use the emotions properly and meticulously so that we should never feel guilty at the end of the day. And also our coping strategies will be very much effective.
Thank you, Ms. Jaitri. We would also like if you could answer some of the queries in Hindi as well. We'll be moving to the next question. A patient wants to know that how to manage insomnia during chemo and radiation treatment. How to make sure the patients have a good quality of life while fighting side effects. Ms. Jaitri, what is your take on that?
So I guess the answer already I have given to manage the insomnia. So, but I would rather like to name it as sleep disturbance or intermittent sleep pattern. Insomnia definition is something else. So to manage the sleep disturbance or intermittent sleep pattern or late onset of sleep, dreaming in between or waking up in between multiple times, I guess the first question was regarding that as well. To know more about it, please consult us through OncoBuddy. And the another question that you asked, Maria, that how to manage a proper quality of life during the chemo sessions, right?
Yes.
Okay. So here the first important thing is to manage a proper holistic quality of life or holistic lifestyle management. And the moment we talk about holistic lifestyle management, that means following a proper diet, first of all, which is very important, and our oncodietitians are there to help you on that. Number 2 will be properly water intake. There are multiple ways so that you can increase your water intake, that you can again consult our oncodietitians. Having a proper sleep at night only. Make sure that you are sleeping majorly at night. Morning, surely you can sleep, but it should be small naps multiple times rather than sleeping for a long duration. Third thing will be walking on a regular basis. Fourth one will be practicing multiple stress management techniques. It can be basically mindful meditation technique. If you want to know more about it, please connect with us through OncoBuddy. Another thing is that always trying to engage yourself into the normal day-to-day activities without even thinking that I'm not well, I cannot do that, I will not be able to do that. So the moment you are continuing your life as much as possible and you are consistently motivating yourself for that, it's like one step ahead. You can always achieve a good quality of life. So let me summarize my answer. The first one will be having a very good diet, enough water intake, regular walking, regular mild physical exercise as per surely your doctor's recommendation, deep breathing exercise or any sort of stress management techniques, and again, engaging yourself into normal day-to-day life.
Thank you, Ms. Jaitri. That was a wonderful answer.
Jaitri, एक पेशेंट ने पूछा है कि कीमोथेरेपी के बाद उन्हें बहुत भूख लगती है, दिन में तो लगती ही है, रात के वक्त भी बहुत भूख लगती है, तो वो ये पूछ रहे हैं क्या ये नॉर्मल है या सिर्फ उनके साथ ही ये हो रहा है या अदर पेशेंट के साथ भी ये होता है?
अदिति, ये सवाल के लिए मैं पेशेंट को बोलूंगी कि क्या सर, भूख एक ऐसा चीज है जो बस हमारे जो ऑन्को डाइटिशियंस है, क्योंकि पर्टिकुलरली आपका जो भूख ज्यादा लग रहा है वो कीमोथेरेपी के बाद ही लग रहा है या दौरान लग रहा है, सो द मोस्ट इंपॉर्टेंट थिंग इज दैट आप प्लीज जो हमारे ऑन्को डाइटिशियंस है हमारे ऑन्को बडी में 4 बेस केयर के साथ, प्लीज आप उनके साथ सलाह कीजिए, उनके साथ आप काउंसलिंग सेशन बुक कीजिए, एंड लेट मी टेल यू दैट दे आर द बेस्ट पर्सन टू गाइड यू ऑन दैट.
Yeah, Jaitri, so we got one more question in Facebook.
Okay.
The question is, do you think progressive muscle relaxation can be suitable for cancer patients?
Would you like to repeat the question once again, Kumar?
Yes. Do you think progressive muscle relaxation can be suitable for cancer patients?
To answer this question, I will definitely say that yes, it can be used. Even multiple research articles have proved that as well, that progressive muscular relaxation technique, means basically JPMR we call it, that can be very much effective for cancer patients for the muscular relaxation, definitely. But again, the point is that even if you are practicing it or you are going ahead with any relaxation strategy, please consult with your psychologist, because our counseling sessions are always personalized. Here I've mentioned that JPMR, which is the muscular relaxation or probably the abdominal breathing or the deep breathing or here and now approach, that doesn't mean that all these interventions will be applicable for everyone, because the counseling sessions are extremely personalized and customized. So yes, for one patient can be JPMR very much effective. For the another set of patients, probably it is definitely not at all effective. So for that, I will request Kumar that please inform the patient to connect with us directly and to book the session in OncoBuddy or to post the question in the OncoHub section so that we can explain it elaborately. Because I would like to know the site of the cancer, the stage of the cancer, currently what is the physical condition. Only then we can recommend him a proper personalized relaxation strategy.
Thank you, Jaitri. So we do have another question also. So here the question is, I want to ask you that how should I cope up with the fact that my relatives are diagnosed with cancer? This fact was hidden from me from last 2 years. I feel angry and lost at the same time.
Ma'am, again, so to the caregiver, my answer will be always try to, like sometimes we need to be very much empathetic and we need to always focus upon why rather than what. It means why you were not informed rather than exactly what happened. I completely agree that probably they did not inform you because they thought that you will feel bad. Probably because they thought that you will feel hurt. Probably you are very close to the patient. That's the reason. So I will recommend you that please do not feel angry or please do not feel bad or please do not feel that you are not the part of the family. Rather than please feel free that you are a very integrated part of the family. And that's the reason they thought that you will feel bad. And that's the reason why they did not break that diagnosis to you.
Thank you, Ms.
Thank you, Jaitri,
for that wonderful answer. We'll be taking the next query. Another attendee wants to know that what your take is on hypnosis and hypnotherapy in dealing with pain and enhancing sleep.
Okay. So my answer will be surely many research articles. It has been proved that yes, these can be very much helpful for the pain management and also the better sleep. But again, I will strongly recommend you, please choose the right person for applying these very crucial techniques on you. Do not go into any person. And number two, that please consult with your oncologist before consulting to them. Because what we wanted to do, that we want to achieve a good quality of life by implementing multiple supportive care techniques. So whenever we are choosing something, even if we know that as per the research or as per the current strategy, this can be very much useful, but whether I'm going to the right person, my therapist is absolutely trained in that, and whether there is a possibility of my better prognosis. These things are very important to discuss before you are starting your therapy sessions. And as I said, again, please consult with your oncologist before going ahead with any sort of therapies, particularly hypnosis.
जैत्री,
Yes,
एक पेशेंट ने और भी पूछा है
हाँ जी,
कि ये जो कैंसर है ये बहुत कीमती बीमारी है, अगर हम बहुत एक आम भाषा में बोले तो, क्योंकि इनकी जो ट्रीटमेंट है, इनका दवाई लाखों में आते हैं। तो इस दौरान एक केयर गिवर होते हैं, उन्हें दोनों साइड मैनेज करना पड़ता है। एक तो उन्हें फाइनेंस भी मैनेज करना पड़ता है, दूसरे पेशेंट का भी उन्हें ख्याल रखना पड़ता है। तो अगर आप थोड़ा इस पर कुछ बताएं कि कैसे ये जो फाइनेंशियल बर्नआउट है उसे मैनेज कर पाए कोई केयर गिवर।
So my answer will be that I completely agree with that cancer is a very, very expensive treatment, and it's definitely not a 1 or 2 days treatment protocol. It's a very lengthy treatment. The duration is very long, and it's not only the financial burnout, your physical burnout will also be there. Because of that, you can be stressed completely. But here, the point that we always like to focus upon the stress. The moment your stress level is very high, number one, you will not be able to brainstorm properly to find out the possible resources or probably what can be done. What are the sources of financial resources I have from I can get, or else I can just seek help, or what can be done. So I will strongly focus upon managing the stress level so that my brain can function properly to probably, to brainstorm how I can manage my financial constraints, probably by contacting with the organizations, multiple NGOs are there, probably, or my consultant doctors from whom I am taking the treatment, what other possibilities are there, or sometimes in the hospital itself, the social workers departments are available. Probably I can try to connect with them. So what are the other resources, or how probably I can manage the financial burden? So coming to the summarization of the question, first of all, it's very important to manage the stress, because then only my brain will be able to function properly for brainstorming, so that I will be able to figure out the multiple possible resources for arranging my finance. Number two will be, I need to always talk to the multiple NGOs or multiple organizations, and majorly the consultant oncologist, if I have any other possible resources to manage this situation.
Thank you, Ms. Jaitri. We'll be taking our next query. Attendee wants to know that in case of anxiety and uneasiness, can medicine be used to manage them?
Surely, in terms of if you have severe anxiety and if you have severe psychopathologically proved anxiety symptoms, for example, severe palpitations, severe onset of dreams, like shivering, sometimes breathlessness, cold feet and cold hand, and if you're not able to control it at all, and if those are really affecting your interpersonal communication, your occupational concerns, and also your day-to-day activity, for example, eating, cooking, bathing, wearing clothes, ironing your clothes, and whenever you are going to, like talking to your parent, if those small things also you are not able to manage and you are not able to cope up with the breathing techniques and other psychological intervention, then surely it's absolutely recommended that you can go ahead with any sort of medication. But here, Maria, let me add this, that if your doctors, they are suggesting, please do not avoid taking the medication, because again, your doctors are the best person to prescribe the right medication for your condition.
Thank you, Ms. Jaitri. That was another wonderful answer as well. We're moving to the...
एक और पेशेंट ने क्वेश्चन की है कि उन्हें लंग कैंसर है, उनके बोथ लंग पर नोड्स हैं और उनमें एक बड़ा है, मतलब लंग में नोड्स, 2 नोड्स है, उनमें एक बड़ा है, करीबन 7 सेंटीमीटर है, और उन्हें बहुत ज्यादा बैक पेन भी है और जिनमें एक बहुत राइट बैक की तरफ वो पेन होते हैं, तो क्या ये कैंसर की वजह से होते हैं?
So Aditi, my answer will be for that first of all, the oncologist, they are the best person to answer this question depending upon the reports. Please consult with your oncologist and please go ahead with any tests if the doctors they are suggesting you. And I'm sure that if you are getting pain, the doctor will surely suggest you any sort of pain medication, or probably they can refer you to the physiotherapist or occupational therapist as well. As you mentioned, the patient, he has been diagnosed with lung cancer. Then, sir, please connect with your oncologist and please address this matter without any confusion. And I'm sure that they will guide you with the right medication and if possible, physiotherapist or occupational therapist as well. That can be a little relieving for you.
We'll be moving to the next query. An attendee wants to know that if cognitive behavioral therapy is really helpful in managing pain, so how to guide a patient in starting CBT?
So yes, I completely agree that the cognitive behavioral therapy can be very much helpful for managing the pain. Now, cognitive behavioral therapy is of multiple types. First of all, the way we address that, physical pain is always been associated with the psychological pain. It means if you're upset or if you're anxious or if you're angry or if you have very severe low mood, then your perception of the physical pain will always be more. For example, if as per the pain scale, your pain is 6, your physical pain is 6, but the moment you are absolutely upset or you are low mood, you are distressed, then surely your perception of pain will be either 8 or 9. So coming to the question, that it's very right that yes, multiple cognitive behavioral therapy can be very much helpful, but I would like to address that mainly cognitive therapy rather than cognitive behavioral therapy. Yes, the cognitive therapy can be very much useful. For that, again, my major recommendation will be whenever you are analyzing the pain or you are perceiving the pain, try to always remove the psychological pain, in the sense anxiety or your distress or your adjustment issues from your physical pain, rather than try to focus on only the physical pain and address your doctor. And the moment you start practicing managing your distress or your anxiety factors and other psychosocial concerns, then surely you can understand your threshold of pain will be much higher, in the sense you will be able to cope up with the pain more effectively.
Thank you, Ms. Jaitri, for the wonderful answer. We'll be moving to the next query. An attendee wants to know how to control their depression and anxiety. They recently acknowledged the fact that cancer might be genetic in the family. Till now, they are not affected by cancer, but it's still a fear in them. So how to manage it in a familial way?
Okay. If there is a fear, we need to understand, is it the real fear or that is the anticipatory fear? And if you feel that there is genetic mutation in the family members, first of all, it needs to be diagnosed properly. We cannot imagine that probably for the next generation, it will be there. For that, yes, as you all know, that food-based care has certain diagnostic tests that can really be helpful for you to get the idea. So, sir, first, my recommendation will be, I can completely understand that if generation to generation you have seen that and you have experienced that people have been diagnosed with cancer, then surely the fear factor is very real. But again, whether we will be diagnosed with it or my next generation will be diagnosed with it, for that, the diagnostic tests are mandatory without any question. So, as a psycho-oncologist, my recommendation will be first, without fearing the fact, I need to get a proof out of it. In the sense, I need to go ahead with the diagnostic test. Number 2, if the result is 0, in the sense, if there is no probability that my next generation can be affected as well, then I need to ask myself, Whatever I'm thinking, that is I am anticipating. That is not the truth. So that is basically I'm thinking about the future rather than I always need to think about my present, and I need to think about that only, because the anticipations and the fear factors will always come because I am assuming it. I do not have any real base on it.
Thank you, Ms. Jaitri, for that answer. I'm sure it's going to be very helpful. If participants have any more questions and queries, please do put them in the chat box so we can answer them.
Yes. Yeah, Jaitri, we have one more question here.
Yeah.
So, one attendee is asking, what is CBT? Is it really helpful in managing pain? Please guide.
Okay, Kumar, already I guess that we have answered this question. So CBT is basically the cognitive behavioral therapy, in the sense the cognitive behavioral modification therapy, where we try to remove the cognitive distortions from your mind and we try to help you to achieve a realistic overview. So for example, you are thinking that I'm getting severe pain. I will not be able to work at all. Probably because of this particular medication or this particular diagnosis, or probably this particular stage, I'm experiencing this sort of pain. Probably that is not true as per your medical report. So as a psycho-oncologist, what we do that through the therapeutic intervention, we try to make the patient understand that that is not the truth. This is the reality. These are the factors that you are getting pain, and that is the actual level of your pain. Probably the perception of the pain, as I said about the cognitive distortion, that can be 8 or 9. The patient is assuming that I have severe pain because, we should be 8 or 9, but that is really not the truth. If we start giving the cognitive behavioral modification therapy as a psychologist, we can help the patient to understand that that level is probably 4 to 5. That is basically the low or moderate level of pain. So yes, the pain can be managed, but one of the most important thing is that stress management, as I spoke earlier as well, to remove the psychological pain for the physical, like from the physical pain, so that we can get the actual idea about the physical pain that is experienced by the patient. So yes, coming to the answer, the cognitive behavioral therapy, it's really can be helpful.
Thank you, Jaitri. And we also got another question here. So, okay, why is family counseling important during the test we take? How will it benefit everyone?
Okay, fine. So, first of all, my answer will be that before the test, whenever you are taking, I'm sure that our genetic counselors are best person to explain you about that. I guess, sir, you are asking the same question. But if I tell you that it's not only about the before test or after test, during the entire journey, the psychological support for the both patients and family members, it's absolutely mandatory. Because as I spoke earlier as well, that this is not only a 1 day or 2 days story. It's a month. The duration is really, really long, and the emotional turmoil can come at any point of time. That's the reason it's very important for the consistent support and the consistent motivation to both the family members and the patients, so that there can be mutual support. Because here the caregivers, they have their own work, probably own personal life, and also other concerns as a human being. Plus, they're 24 hours giving the quality time to the dearest one, who is the patient. So surely there can be emotional burnout, there can be caregivers burnout. So during the entire session, it's very important that we are providing a mutual support to each other. That's the reason staying in consistent touch with the psychologist, so that any point of time, the emotional support can be given. That is very important.
Thank you, Jaitri, for the answer.
I think we have now come to the end of the question and answer session. Thank you, Ms. Jaitri, for answering all our doubts and queries. I'm sure it was very helpful to every one of them. Though there were loads and loads of questions asked, because of the restriction on time, we could not answer all of them. Ms. Jaitri, though, will be available in OncoBuddy 24/7 to answer all your questions. So please check out our new digital healthcare product, OncoBuddy application from Forbase Care. This is a 360-degree digital healthcare platform that aims at providing a holistic support to cancer patients and caregivers in their fight against cancer.
So let me inform all the participants today that from the OncoBuddy, the patients can book the consultation with the concerned oncologist, the counseling session with our psychologist and the dietitians and as well. You all can connect with the cancer patients probably who are in the same journey along with you. You can post your queries in the OncoHub section. There is a section called Ask the Expert. You can post your questions over there. Additionally, from OncoBuddy also, you can get access to multiple structured and validated content of cancer care. So we are always there. So please feel free to post your questions over there. As I said, there is a section in OncoHub, which is the Ask the Expert section, and we will always be there to answer those questions. Now, please check the application OncoBuddy. The link will be shared in the chat box. You can download, you can install the application directly on your Play Store from the chat box, and please try to update it once in a while. That is very important because often we try to update the app from our side as well. And also please feel free to share your feedback about the meeting. So like today, we know that we have so many questions we got, but we could not answer all the questions because of the time constraint. So yes, we are there in OncoBuddy to answer all the questions. So to book the questions, please note down the number. Our contact number is 91, which is the India's code, 6366843 Let me repeat the number once again. This is +91 6366843415. You can mail us at info@4basecare. I'm repeating the email ID once again, info@4basecare. And also you can post your questions in OncoBuddy section. Please get in touch with our care companions to book the psycho-oncology session as per their requirement.
Just one last question, Jaitri. Sure. One of our patients has asked that some of the patients struggle to buy the medicine in market as it's very expensive. What can be the solution?
Okay. So first of all, my suggestion will be you please connect with your concerned oncologist for the same. And also please connect with our care companions, because if any doubt is there regarding purchasing the medication, feel that if we have anything, then surely our care companions can guide you on that. But first of all, I will ask you to please connect with your oncologist. And as I said, for every hospital, like most of the hospitals, they have a very strong social work department as well. Probably they can guide you on that, like what is the right place or how you can get the medication easily. So both the processes are available, sir.
Thank you, Ms. Jaitri. If there are any more questions, you can get with your care companions and they can help you with the answers by contacting the psycho-oncologist through OncoBuddy. Thank you, everyone, to all the participants for joining this session. We hope to see you soon next month. Thank you.
Take care, everyone, and wish you all have a very good health.